Hi, this is Dr. Desmond White, gastroenterologist and hepatologist. Often I see patients with liver cancer. In the technical term, we call it hepatocellular carcinoma or HCC. Why? Because when we say liver cancer, it can be something come from the liver or some cancer come from elsewhere like colon or breast that spread to the liver. So when we say liver cancer in layman term, as a hepatologist, usually I see people with hepatocellular carcinoma. It implies that they get the cancer from the liver itself. So it's like a primary liver cancer. As I mentioned in my previous video, people with primary liver cancer or HCC, hepatocellular carcinoma, will have normally high elevated alpha fetoprotein, and they have a risk factor for liver cancer, such as liver cirrhosis, hepatitis B, hepatitis C, advanced fatty liver, or they drink a lot of alcohol, damaging the liver. So when I see a patient with hepatocellular carcinoma, often patient will ask me, or the family member will ask me, what stage is my relative or myself have liver cancer? Now, when we see staging, most people are heard of stage 1, 2, 3, 4. In layman term, roughly stage 1 means the cancer is confined to the primary organ. Say for liver cancer, say for colon cancer, if the cancer is only on the lining of the colon, what we call the mucosa, chance is very good. When we say stage 4, means the cancer has spread beyond the primary organ. So someone with liver cancer, that the cancer spread to the liver or the lung or the bone, we call it stage 4. So for most cancer, we call it stage 1 to stage 4, depending on how widespread the cancer is. And obviously, the further they spread, the worse the chances of long-term survival. But I'm not talking about colon cancer. I'm talking about liver cancer. So liver cancer staging is very different from the rest. We don't normally use the staging of 1 to 4. Why? Because it is very complex. Now, this is a paper published in the Journal of Hepatology, one of the most prestigious liver journal. It's written by a group of liver specialists from Barcelona University Liver Hospital Clinic. Now, the University Clinic of Barcelona is one of the best centers for liver cancer. They are even better than Singapore, though we thought we are the best. We are not, okay? They are one of the best centers in the world. When I've spoken to some of these doctors before, I listened to lectures, I've spoken with Professor Jordi Brooks before. In Barcelona, in Spain, they have a different system. All the advanced liver cancer, or all the even early liver cancer, they're sent to one particular place, that is a University Hospital Clinic at Barcelona. As a result, they have tons of cases, and they have lots of experience, and therefore, based on their experience, they share with the rest of the world, and they have guidelines. And the BC stands for Barcelona Clinic, liver cancer strategy. So Barcelona Clinic is even in the name of the guidelines. So they wrote a lot of guidelines, and it's even accepted by many authorities, including the European Association for the Study of the Liver, EASL. So this is what we normally practice. So I would share the link of this paper in the comment below. For those of you that are academically inclined, they want to know the detail, you can read all this paper. So as we read through the paper, let me tell you how we stage liver cancer. So when we stage liver cancer, actually there are 3 factors that we talk about. The first is the size of the cancer. Usually, the smaller the cancer, the lesser the chance that it has spread. And the larger the cancer, the higher the chance it has spread. Also, the number of nodules. If they have only 1 nodule, the chance is good. If they have 3, 4 nodules, the chance is not good, because if they have a lot of cancer nodules within the liver, they could have spread, or they're probably more aggressive. But besides the cancer size and the number of nodules, we also look at the preserved liver function. That means how bad, whether they have liver cirrhosis, if they have liver cirrhosis, how bad the liver cirrhosis is. So if they have advanced liver cirrhosis, they vomit blood, they have ascites, they're deeply jaundiced, then treatment becomes difficult. But if they have a good liver function, we can still proceed with resection or ablation. So second factor is the liver function. The third factor is what we call the performance status. That means how fit the patient is. Now, it is roughly related to the age. Most of the time, when you are younger than 50 or 60, you are still very fit. But if you are older than 70, 80, most of us tend to be weaker and have other medical problems like the three highlight: hypertension, diabetes, and cholesterol. So therefore, the three factors to look at in staging liver cancer will be the size of the tumor and the number of nodules of the tumor. One. Number two, the liver function, how good or how bad the liver cirrhosis is. Number three is a performance status, whether they are walking in, they are healthy, or they have a cardiac stent put in before, they have a previous stroke, they have a severe hypertension, they are on dialysis, all that. There will be a worse performance status. So therefore, based on these three values, we will grade the patient liver cancer into very early stage, intermediate stage, and advanced stage or terminal stage. If they have very bad liver function or they're very sick from other non-liver problem, they're what we call at the terminal stage. Then it doesn't really matter how much cancer they have. I repeat, if they have very bad liver cirrhosis or they have very bad performance status, they have heart failure, they're on dialysis, they're very sick, it doesn't really matter how bad the cancer is. They're not going to survive very long. But if they're very early liver cancer, small one and only one nodule, and liver function is good and they're physically fit, then we have lots of options. So when you ask a liver specialist like myself, what is the stage of the liver cancer? I often tell patients, well, the three factors: cancer factor, the patient's liver function factor, and number three, the overall medical fitness. So we grade them into early, intermediate, advanced, and terminal. So different patient is different, and sometimes along the way they can change. They can have a very bad performance status. They're very weak because the cancer is affecting the liver. When we treat the cancer, they improve. I have patients that come in on the wheelchair with liver cancer. After we treated the cancer, instead of coming in the wheelchair, they walk in. So the performance status can improve. And sometimes some of the liver function can worsen. I've also seen patients that when we treat the cancer, we arrested the cancer, but we worsen the liver function. So therefore, all these are fluid. So next time when you see your doctor for liver cancer, you may want to tell the doctor, if you have read my video, when you watch this video, instead of asking a patient, your doctor, do I have stage 1 to stage 4 cancer? We actually use a Barcelona Clinic liver cancer staging system to say that instead of 1 to 4, we use A, B, C, D. A being early stage, D being the terminal stage. And there are three factors involved, okay? To sum up, so staging of liver cancer is very different from staging of other cancer. Because instead of just the cancer alone, we look at how good or how bad the liver is, and also how good or how bad the patient is, in addition to the tumor factor. These are the treatment available. I hope I don't confuse you too much, okay? Dr. Desmond White.